what we wanted to do was try to understand what lessons we can get from epidemiology and epidemiological modeling. So I'll just talk about what we did first and then what we learned from that. So we wanted to understand what a pandemic is, how it works, what epidemiological models exist, and what they'd be useful for. And most importantly, what we don't know as well as what we know. And to this end, we worked with and we reached out to Professor Mark Lipsitch and group at the School of Public Health, who are very generous with their time and helped us understand what these models were. And we tried to gather as much information as possible from other epidemiologists as well, including Dr. Alison Hill at Johns Hopkins. And we used various existing models that were out there, as well as built our own custom models to try and simulate all the possible policy scenarios or various relevant policy scenarios and understand how various parameters and phenomena in society would affect these parameters. And try to see what would be most relevant to the governments that we were working with. So we tried to act as a bridge between the epidemiologists and the lessons from the epidemiology and several governments. So either directly or indirectly, we worked. We tried to pass along these messages to governments of Albania, Ethiopia, El Salvador, and several others. And to go on to what we learned from all this work, the primary thing we learned was that there was a lot of uncertainty involved. But these models, even though they are not accurate, were very useful as tools that could help contrast policy scenarios. We understood what the parameters such as the reproduction number and how targeting these parameters would be important. And I think one of the most important lessons to me was that there was a lack of nuance in public messaging. So according to the models, we learned that a complete return to normal after a lockdown would not flatten the peak and would just buy us time for the healthcare system. And that the pandemic was something that would go on for an extended period of time, and the economic impacts from the pandemic would also go on for potentially years from now, and that was very far from what the policymakers that we were working with very often started with their assumptions from. And so, we also learned that low-cost interventions were critical, and we tried to spread that message around as well.